Hi, I just did a couple of videos on some shiatsu holds for hot flushes in the perimenopause or maturescence, and also morning sickness in the first trimester of pregnancy. And you may, if you've watched both of them, think, oh, but they're quite similar in terms of what I showed. So in this video, I want to just explain a bit why I did what I did. If you haven't watched those two videos, watch them. But basically, both hot flushes in the perimenopause and morning sickness in early pregnancy, energetically in traditional Chinese medicine, are the same cause, which is essentially changes in the flow of our blood. In pregnancy, in the first trimester, our body has to get used to not menstruating anymore, and because we're not menstruating anymore, we're not releasing blood each month. Menstrual blood for the Chinese is called heavenly essence, and it's an expression of our womb energy and our life force. And so it's more than just the physical blood that comes out. And they say that when we stop menstruating, the gate of the womb closes to hold the blood within, so that each month that we don't menstruate during the 9 months of pregnancy or the 10 lunar months, then this blood or this energy can be used to nourish and support our baby. But it takes a couple of months usually for the body to get used to this change in the flow. And so what tends to happen is that instead of feeling, oh yeah, the blood's coming out as in menstruation, the blood is staying in. And if we're not anchored enough, especially around our kidney area and around in our girdle vessel area, our pelvis, this blood tends to flow up. And that's the cause of, energetically, that's the cause of nausea and also emotional anxiety, instability in pregnancy, even tiredness. And it's actually not a dissimilar pattern in the perimenopause. In the perimenopause, we start having less regular periods, we may be bleeding less heavily, and our body is beginning to get used to not having this monthly flow of blood. And the blood is not being used so much to blood as a transformation of essence is also used in Chinese medicine to mature the eggs. And because we're not necessarily maturing an egg in every cycle, then again, that energy isn't being used so much. So it's changing in its nature, not quite as dramatically as in the first trimester of pregnancy, but nonetheless, our body is beginning to get used to the fact that one day we won't be menstruating anymore. And even when we're not menstruating anymore, we still might have a time of hot flushes because our body needs to get used to what to do with this blood that isn't being released anymore. So again, it's the same pattern as in pregnancy, blood not being held, blood rising up. And so the main vessel to regulate all of the blood in the body is one of the extraordinary vessels which regulate the essence, and that's the penetrating vessel. So we have a diagram of the penetrating vessel here, and you'll see that the penetrating vessel actually begins in our lower back at the gate of life, and it emerges on our perineum. Well, in our lower back, it's internally. It's in fact between our kidneys and our womb, the origin of life. And it emerges on our perineum, and there's a branch that goes up each side of the midline to our throat and then around our mouth and to our eyes. And it's up this branch that we feel often the hot flushes. There's also a branch in the lower back that goes into our kidneys. And then there's also a branch down in the legs that goes down to the earth. And so that's why in the videos that I showed of techniques to calm hot flushes, we're working these core areas of the penetrating vessel, the sea of blood. Placing a hand on the womb, as you can see on the diagram, there's a few points around here that you can use. Stomach 30 is a very good grounding point. On the lower back is the Ming Men Gate of Life point, governing vessel 4. In the upper part of the body, I didn't so much insist on the actual points each side of the midline, but you are covering them if you work with your heart. You can be even more specific and put your fingers on the kidney points, which are 2 thumb widths from the midline, and hold your breasts. Often there's breast tenderness in the first trimester of pregnancy, and there's also breast tenderness in the perimenopause. And then you could in fact use both hands to come down to the center, but I often like using one hand because the other hand can stabilize and help things move down. And then the other part was working down in the legs. There were techniques to go down the legs, and there's a point on the knee, just below the knee, and then you focus down to connect with the earth and kidney 1, the bubbling spring, the most yin or the most anchoring earthing point in the body, and then spleen 4 is the point at the base of the big toe. That's grandfather, grandson. I like that because it reminds us that we have our male ancestral line as well as our female ancestral line, that we're yin and we're yang, and our menopause and our experience of pregnancy, certainly our experience of pregnancy, when we're joining the male and female ancestral lines through the egg and the sperm. It's nice to focus on this point, grandfather, grandson, and the male line. So I hope you enjoyed this little introduction to the changes of the penetrating vessel during early pregnancy and in the perimenopause. If you'd like to find out more about the penetrating vessels and women's health and cycles of blood, I have a much longer video on the penetrating vessel, and it's accompanied also by its pair, which is the girdle vessel, which is a very important vessel for the whole pelvic area. If you have any questions on any of this, then please don't hesitate to leave a comment. If you enjoyed this video, then also please leave a comment and share with a friend. Thank you for listening.